Hello, Dr. Sanfras. This is SGD B5, and we're going to present our student project entitled Medical Legal Aspect of Telemedicine Medical Services. And this is the list of our members.
And friends, my name is Madini Lamrai Nirmala with last 3 digits of the student number 106. So currently there is the term telemedicine in the world of health related to the use of technology in interacting. Telemedicine allows for coordination between health workers in dealing with patients as well as consultation between patient and doctors indirectly due to impossible conditions such as the COVID-19 pandemic. The use of telemedicine certainly has advantages and disadvantages. The service is also inseparable from the application of medical ethical principles, and there are also several violations of this principle due to uncontrolled use of telemedicine service. These problems can then be overcome by applying the medical legal aspect as a bridge between medical science and legal aspect. Medical legal aspect can help physicians to find out medical action that cause harm to patient in accordance with this aspect. Through this paper, the information about medical legal aspect and telemedicine medical service will be discussed further.
Let me introduce myself. My name is Zafira Kumaladewi with the last 3 digits of student number is 122. I will continue the explanation about problem formulation. Based on the background, there are 5 problems that need to be assessed. 1. What is the definition of telemedicine? 2. What is the definition of medical legal? 3. How is telemedicine legality in Indonesia? 4. What are the advantages of telemedicine? And 5. What are the disadvantages of telemedicine? Next, the objectives. 1. To understand the definition of telemedicine. 2. To understand the definition of medical legal. 3. To understand the telemedicine legality in Indonesia. 4. To understand the advantages of telemedicine. And 5. To understand the disadvantages of telemedicine. Next, benefit of research. There are multiple benefits that can be gained by a medical student from doing this student project assignment. First of all, students are able to understand the medical legal aspect of telemedicine medical service more depth as one of the basic competencies of this block. Furthermore, students are able to comprehend the definition, legality, advantages, and disadvantages of telemedicine medical service. Finally, by apprehending the medical legal aspect of telemedicine medical service, medical students are more exposed to the medical world. That's all from me. Thank you.
My name is Karen Angela and my student ID number is 2102511116. So, according to the Indonesian Ministry of Health, based on Article 1, Paragraph 1 of the Regulation of the Minister of Health of the Republic of Indonesia, number 20/2019, concerning the implementation of telemedicine services between healthcare facilities, telemedicine is defined as the provision of healthcare services remotely by health professionals using information and communication technology, including the exchange of information on diagnosis, treatment, disease and injury prevention, research and evaluation, and continuing education of healthcare providers for the benefit of improving individual and community health.
Hello, teachers and friends. My name is Gwanet Felicia with student number 21025111110. And today I'm going to explain the part of what is the definition of medical legal. So as we all know, medical legal is something, and it is refers to things that are related to medicine and law, medicine practices and law. It is a field of study to understand the connection between medical practices and also legal practices in each of their own countries. So Indonesia have its own medical legal aspect. So why is it important? Why is medical legal important? Because there are two different point of views. From medicine perspective, it keeps a clear line between patients and healthcare workers' rights and duty, in this case, doctors. And it draws a line which cannot be crossed by the two of them, and it gives a guideline too for the doctors or healthcare workers on doing their job and thinking what should be done, what should not be done. And then there's the second one from the law perspective, which is the medicine has law perspective to solve medical legal cases, which I will explain further. And it gives evidence and statements for medical legal cases and cases such needed for needed medicine statements or evidence in it. So, what is medical legal case? Medical legal case is the cases where medicine and legal aspect are combined together. For example, compliance cases, malpractices. That is this example of medical legal cases. There are also cases which is like forensic cases, which involves medical legal perspective. So here are the list of the medical legal laws that are applied in Indonesia. So as we can see, the first one is law number 29, year 2004 about medicine practice, which we all know. And then law number 44, year 2009 about hospital and its concerns. Law number 36, year 2009 about health. Regulation of Ministry of Health, Republic of Indonesia, which I give example of the on medical treatment and about medical record. And then the regulation of Ministry of Health, Republic of Indonesia, number 36, year 2012, about secrecy. And then the government regulation number 10, year 1966, about medical confidentiality and secrecy. And also the last civil laws about medical malpractices and etc. There are a lot of laws that are currently abiding for the medical and legal. That's it from me. Thank you for listening.
Hello doctors and friends, my name is Sister Natalia with the 3 last digits to the number 109. Now I will present about telemedicine legality in Indonesia. Since telemedicine was first issued in Indonesia, there have been many regulations set by the government regarding its practice. The main purpose is to allow doctors to legally practice telemedicine in Indonesia so even remote areas can get easy access to healthcare. The first regulation is in Minister of Health Regulation number 90 of 2015 concerning the organization of health service facilities in remote areas and very remote areas. Its main purpose is to support health services in remote areas by increasing the accuracy and accelerating the process of providing medical diagnosis, consultation, and other health services facilities in areas with the lack of health workers of those qualifications. Then, for further application of MOH Reg 90 of 2015, especially the telemedicine services, the Minister of Health issued MOH Regulation number 20 of 2019 on organization of telemedicine services between health service facilities, which specifically regulate the organization of telemedicine. There are two types of health service facilities as defined in the MOH Regulation 20 of 2019. The first is consultancy providing health service facilities, which are hospitals owned by the central government, regional government, or the private sector that provide the telemedicine services. The second one is consultancy requesting health service facilities, meaning the hospitals, first level health service facilities, or other health service facilities that request the telemedicine services. But then, ever since the pandemic, the government are forced to update the regulations. That's all from me.
Hello, doctors and friends. My name is Novia Indratmo, and the last 3 digits of my student number is 119. Allow me to continue the presentation on telemedicine legality in Indonesia. So because of the COVID-19 pandemic, there has been a rise in telemedicine, and as a result, there has to be new regulations that are made to control the use of telemedicine and also how to practice it. For example, KKI, or the Indonesian Medical Council, issued the regulations number 74 on 2020 on clinical authorities and medical treatment through telemedicine during the COVID-19 pandemic. Here, they require doctors to have a registration letter and also a practice permit in order to be under license and in order to practice telemedicine. Without these, they become illegal. They can practice telemedicine through text, voice or video, and also an application or a system. They are also required or obligated to write medical records on each individual patient. Another example of the regulations is from the Ministry of Health Decree number 4829 on the guideline on telemedicine healthcare services during the COVID-19 pandemic. Here, doctors are required to routinely monitor the patients, like their vital indicators and pre-existing conditions. They are also required to educate their patients, their communities, and also their family. They have to provide prescription and also give referral letters if the patient can get any worse.
Hello, Doctor and friends. Let me introduce myself. My name is Grace Veronica Wijaya with three last digit of my student number 11 and 3. Now we will talk about the advantages of telemedicine. First is make access to healthcare easier. With telemedicine, patient can get healthcare easier when needed at any time and anywhere. Doctor and their uneven distribution leave patient in some areas unable to achieve healthcare. This condition can be overcome by technological advance that make people able to access whatever they want when connected to the internet. Telemedicine also helps people with an unable condition like the disabled and elderly who cannot freely access traditional or face-to-face treatment. The next is save time and money. Traditional treatment has expensive costs that can burden patient. In addition, face-to-face treatment makes the patient have to go to the doctor directly, making the patient have to set aside time and make an appointment in advance with a limited amount. The next is improve quality of care. Telemedicine has the potential to increase the quality of treatment through increasing knowledge skill, case management methods, and assisting in the delivery of various medical service. And the next is better outcome of patient mental health. Telemedicine can be done through psychiatrist treatments that can increase patient satisfaction. That's all from me. Thank you.
Hello, doctors and friends. My name is Jupiter Tendraliu with the last 3 digits 114. Now I will present to you about advantages of telemedicine. The first one is potential for technological advancement. Telemedicine can be done by using mobile phones, computers, or maybe laptops. By using technology, there is an advancement, especially in the medical area. One example of technological advancement in telemedicine is remote surgeon. Patients can send their surgical wounds image with a clinical evaluation questionnaire via email, and this remote wounds image can evaluate it. Based on the experiment and evaluation, the remote surgeon showed a high sensitivity and specificity number. This new technology might reduce cost to health and increase patients' recovery number. The sixth one is increased patient satisfaction. Based on a study, telemedicine is associated with high patient satisfaction. With the removal of financial disadvantages, easier access to healthcare, and better outcome of patient health, telemedicine has increased patient satisfaction, especially in the pandemic time. Telemedicine has been shown to provide effective treatments and increase patients' recovery number.
Hello, doctors and friends. My name is Stanislav Sotomasarirata with the last 3 digits of student number 115. Now I'm going to talk about the disadvantages regarding the use of telemedicine. The first group is healthcare provider-related disadvantages. This includes the difficulties found by clinicians to operate the systems, and sometimes there may be glitch in those systems. The next one is the behavioral system, where it may not provide lack of trust and conflicts among patients and doctors. The third one is the inability to provide physical examination due to online platform and remote places such as Webex and Zoom. The next one is patient-related disadvantage, and the first one is care delays. Patients need to do certain process in order to gain the time for doctors to get attention and treatment, and also patient privacy is in risk because there are no system that is safe and can be easily hacked by unrepresented persons. That's all from me. Thank you.
Hello, Dr. and friends. My name is Luis Felix Yuanda with 3 last digits of my student numbers 117. These times, I will explain about the telemedicine in COVID-19 pandemic. COVID-19 is an infectious disease that has become a pandemic since early 2020. It's become a need to reduce contact to reduce the transmission of the virus. A mobile telemedicine can be used to prevent the direct contact between the physicians and the patients. by collecting, transforming, and assessing patients' health data that is needed to make a diagnosis, assign treatment, or monitor the patients. The data that will be reported to the attending patients. This way, direct physical contact between the physicians and patients can be reduced, thus reducing the risk of transmission of COVID-19 from unnecessary exposure between the doctors and the patients. Due to these reasons, telemedicine has become more adapted in this pandemic.
Okay, greetings to all of you. My name is Abel Manuel Shanipar with last digit number 118 or 1, 1, and 8. Now we are up to the conclusion. Okay, yeah, the conclusion. So telemedicine, by it means the provision of medical service either between a healthcare provider that is looking for a clinical advice and aid from another healthcare provider, or between a patient looking for a healthcare service and a healthcare provider. And medical legal itself, which is a field of study to understand the connection between medical practice and legal practice in each of their own country, are not a common thing anymore, since there have been some rules and regulations set by the government of Indonesia itself regarding to its practice, the telemedicine. This means that with telemedicine, health professionals are allowed to supply long distance health services, as long as health service provider who is practicing telemedicine service has to hold a legal license to practice in health service facilities. Compared to traditional treatment, telemedicine has a lot of advantages such as easier healthcare access, better outcome of patients' mental health, technological advancement potential, and fulfillment of patient satisfaction. Okay. On the other side, telemedicine also has its downsides, such as the difficulties in operating the system, both by the clinician and the patients, lack of trust and conflicts among clinicians and patients, decreasing capacity of clinicians to perform physical examination, and leakage of patients' privacy. And during the COVID-19 pandemic, telemedicine is used to reduce direct physical contact between doctor and patients, so it reduced the risk of COVID-19 itself transmission. Okay, so that's all from me. Thank you.
My name is Igusti Muradinda Pratyaksa with the last third digit is 1 and 12. So with the conclusion of this paper, we can take the advantage of telemedicine as the result of technology advances while still paying attention to all existing aspects, including the law. Besides being able to make doctor-patient meetings more effective and efficient, telemedicine can also help increase public awareness about the health so that it can improve the health level of a region and even a country. That's all from us, B5, about the medical legal aspects of telemedicine's medical services. Thank you.